Welcome to another episode of Project Safe, Seniors Against Financial Exploitation. In the United States, it is estimated that $25 to $30 billion a year is taken from seniors. That's an amazing number. Seniors are categorized, and retirees. Seniors are over the age of 60, and of course some people retire earlier. In North Hempstead, there is approximately 50,000 seniors and about 20,000 early retirees. And it is estimated that 10% of them will be scammed each year. It's a tremendous number that needs to be addressed. The purpose of this program is to bring to your attention ways to avoid it. And scams can occur every place you go. Today, we're very fortunate to have with us JoAnn Smith, who is the president and CEO of Planned Parenthood of Nassau County. Why would we bring Planned Parenthood into a program like this? Because the purpose of this program is to bring to everybody's attention services that are provided for free or within your insurance costs. And many people get taken advantage of by going to places that are illegal, scams, etc., don't get the proper help, don't get the proper advice. JoAnn, it's a pleasure to have you here, and I want to thank you so much for taking the time to participate in Project Safe.
Thank you, John. I'm thrilled to be here. Thank you, Peter.
I always ask the first question, how did you get involved in Planned Parenthood?
I was lucky. I was working as a consultant, and I heard about this job, and somebody had recommended that I be interviewed for it. And I wasn't available at the time, but when I was finished with the consulting gig, I called the current CEO, the then CEO, and I said, well, if the position is still open, I would love to talk with you about it. And I got the job, and I was at that time, I was the vice president of fundraising and public affairs and education and marketing. And I was in that position until the then CEO left to become the interim CEO of our national organization, which is Planned Parenthood Federation of America. So I was in the right place at the right time, and fortunately, the board then asked me to be the permanent CEO, and I am so lucky to be in this position because every day I see the value that Planned Parenthood brings to the people in our community of all ages.
Right, that's the most important thing. It is of all ages. And one thing that I neglected to say in my intro is I'm John Ryan, I don't think I said that, and my partner Peter Janowsky. Together we are interviewing JoAnn, and I'm going to pass it over to Peter for a question.
Well, my first question is obviously, not obviously, but what does Planned Parenthood provide for men that most people aren't aware about?
I'm so glad you asked that question because most people think of us as a women's healthcare organization, and we are. We are the largest women's healthcare organization in the United States. But we also provide screening and testing for men for sexually transmitted infections. We also do screenings and testing for testicular cancers, which is very important. Years ago, not that many years ago, one of our educators was in the community at a school, and he was with boys, probably junior high school, not junior high school, probably juniors in high school. And he was showing them how to actually perform a self-exam on their testicles. And we heard later the teacher told our educator that this kid went home and did his self-exam, which most boys would be embarrassed even talking about doing. And it turned out he had a lump. He went to the doctor, and he's fine. He's absolutely fine. But had it not been for our educator going into the classroom and talking about this, the need to perform self-exams, he might not have done it. So we save lives. But so we provide, and also just general checkups.
Is that the only type of cancer screening you do? Is just testicular?
For men,
yeah.
Yes.
Okay.
Yes. But we also provide, again, a lot of testing and treatment for sexually transmitted infections, including HIV testing and treatment. Actually, if somebody tests positive, we refer them for formal treatment. But now we just started rather, something called PrEP. And it's a prophylactic, it's a pill that people can take to prevent, women and men, to prevent the contracting HIV.
My gosh, never heard of that.
I know.
Yeah.
It's amazing. It's just a pill. It's a regimen that people have to do. You have to do it every day. You have to do it. You have to be faithful to it, as you do with any kind of medical treatment. But
and what's it called? Is there a name?
It's called PrEP.
PrEP.
P-R-E-P.
Okay. And you know who manufactures that?
I don't.
Right.
I don't. But it's been around for not that long, and it is very effective in preventing contracting HIV.
I've seen commercials for that. If
Yes,
that's
you
the same
have.
one, yes.
It is.
Right, like, be smart, be, you know.
It's like a birth control pill.
Right.
But to prevent HIV.
Obviously, for any age. And how do the fees work with Planned Parenthood?
Well, everything is on a sliding fee scale. So if people come to Planned Parenthood, men or women, and so we assess their income. Actually, they self-report. We don't actually go out and do. We do a very minimal financial screening, and if they so then they're assessed and they are put on a sliding fee scale. If somebody has insurance, then of course we use their insurance.
Naturally.
But if they don't, and even if they are undocumented, we do have funding that allows people who are undocumented to come to Planned Parenthood for, again, free or very low cost based on their income, and that's a true benefit for the people in our community.
Let's talk about funding a little bit,
Yeah,
because
sure.
you obviously turn nobody away.
Never.
Somebody comes to your door,
That
no
is
matter what
correct.
their age,
That
you're
is
going to be
correct.
taking them in.
That is correct.
So funding, that's a big part of your job.
It is.
Because
it is.
obviously you're going to have undocumented, you're going to have documented people that don't have any insurance.
Absolutely.
So you know, but you're not going to turn them away if somebody's sick.
We also have people who have insurance. My daughter, who is 42 and the vice president of finance of her company, goes to Planned Parenthood. And of course she has excellent insurance. And you know why she goes to Planned Parenthood? Because we are open basically every day, well, 9 to 9.
Okay.
We're open on Saturdays. We're open on Friday nights, and we're there when people need us to be there. We're not. So if I was trying to make an eye doctor appointment, and if I can't get there before 5 o'clock, well, I'm not going to get my eyes done
Until Christmas, when you're off for a week.
Exactly.
Right. Yeah.
Exactly. I take time off to do things like that. So we are available when people need us to be. So people can they can call in the morning. They can usually get an appointment that day.
Right.
And so we're available. We have phenomenal health care. I too go to Planned Parenthood.
Okay, that was one
And
of
I'm
the
a
things.
senior.
Okay. Okay.
Yes, I'm a senior, and I go to Planned Parenthood because, as I said, it's convenient. The services are great, and why wouldn't I? It's for
I think
everybody.
that's one of the things we're talking about today, and I want to bring to all the viewers' attention. Planned Parenthood is a wonderfully established state-of-the-art program. This is
Yes.
not something that's being done in somebody's backyard because we're trying to help a few people in the
No,
neighborhood.
no.
This is, and I had no idea, I'm being honest, that it's unbelievable. Your facilities are tremendous.
Yeah, they are.
Actually,
They are.
Where are your facilities? I mean, how many do you have?
We have 3 health centers in Nassau County. Our main one is in Hempstead, and it's a big building. And we see about 20,000 patient visits there.
A year?
Yes, 20,000 patient visits. We have 8,000 calls a month to our health centers. So about 20,000 patient visits there. And then we have 2 other centers, one in Glen Cove, one in Massapequa.
Doing the math, that's 96,000 a year.
We have well, we don't see all. We don't.
No, I know you're not seeing them, but my God,
But we
that's-
actually have about 27,000 patients, maybe 28,000 patients. We don't see that many in the other 2 sites. We don't see the same quantity, but yeah, we do have about 8,000 calls into our call center every month. So we're quite busy, and people come to Planned Parenthood because A, they trust us. B, they do know that they can come regardless of their ability to pay. But also, people come to us because they trust us. I mean, they just, bottom line, trust us. And to provide really high quality care in a confidential setting. And
But that's the most important part of this.
well, you know, everybody wants their health care to be private. That's why we have HIPAA laws.
Right,
We can't share anything with anybody, and it should be that way. And what we are in the process of launching online health services for birth control, which is going to be amazing for people who, so many young people and my age don't want to pick up the phone. They want to go online and do everything.
Right.
So we're going to have appointments online, but also birth control over the phone, if you will, which is great.
I'm just curious, and this is a senior program, basically. A 16-year-old or a 17-year-old, if they come to you, they get treated.
Yes.
I don't understand that part of it. We don't have to just touch on it for a minute.
Yeah, sure.
Because people have grandchildren.
Of course they do. And they have children.
Right,
and, yes, as I do. And my grandchildren are too young. The twin boys are 8, and my granddaughter is going to be 5.
Oh,
and,
okay.
So they're too young at this moment. But they will be going to Planned Parenthood at some point. And sometimes parents bring their kids to Planned Parenthood because they know that it's a good place to go. And sometimes kids, when I remember with my son, when he was going off to college, I wanted to put him in a body bag, in a body condom. I just wanted him to be safe. I just wanted him to be, we all want our kids to grow up safe and happy. And if we could just say no to everything, say no to sex, no to drugs, no to getting into whatever.
Guns, alcohol, the works.
That would be wonderful. It doesn't work that way, unfortunately. And kids want to experiment. So it's very important that people have the information they need to make decisions about their bodies. And so we do that certainly for teenagers in our schools. We work in the schools bringing information certainly about abstinence as being the only method or the only thing that preclude a pregnancy or a sexually transmitted infection. But we also provide them with information about decision making and how to say no. How to say no to somebody who, if you don't want to get involved, how to say not now, I'm not doing this. Thank you very much. And but also to know that they can come to us for services, to get certainly for condoms and for birth control, so that they will prevent both an unintended pregnancy and sexually transmitted infections. It's interesting. People my age think that we don't have to worry about sexually transmitted infections, but they stay with you forever. Right. So we have learned that and heard that people my age have sex.
Absolutely.
They do, and we all need to be sure of our status too, to make sure that we don't have any sexually transmitted infections, and so they can come to Planned Parenthood for that.
That's an interesting concept. Do you find, like a woman or a man, but a woman, a senior, doesn't want to go to her regular gynecologist and ask questions, that would actually come to Planned Parenthood saying, like, oh, what should I be doing? I met this fella, but I'm 65 years old. I'm too embarrassed to tell the fella, my regular gynecologist. I don't know. Okay. I think that I know that a lot of women do come to us when they don't want to go to their gynecologist. Right. Okay.
But again, I just use Planned Parenthood as they're my gynecologist. We're your neighborhood gynecologist.
Right, okay,
that's really what we are. I mean, that's how when I was describing our services once to my uncle, he said, what do you really do? And I said, we're just your neighborhood gynecologist. We do everything your neighborhood gynecologist does. But in addition, we also provide prenatal care, and we do provide a huge, wonderful education programs in the community. Working with the schools, we work mainly in Hempstead, Uniondale, and Roosevelt, and Westbury, and Westbury. We have seen the teen pregnancy rates decline dramatically. They've declined all across the country, which is phenomenal. That is, babies shouldn't be having babies, and in order to help them, that's why Planned Parenthood really exists, to help them make healthy decisions. And so working with the schools and their families together, the teen pregnancy rates are dropping across the country, but really dramatically in the school districts where we provide information, again, about all the things that people need to know. and then we connect them to services at Planned Parenthood, at a federally qualified health center, wherever they need to go or would like to go. And so we're really, I'm so proud of the fact that we are able to provide that information to young people. We also have a program, they're called the Teen Advocates, and our Teen Advocates are teenagers. They may be freshmen, they may be seniors, and they become the source of accurate information in their schools versus all the myths that kids hear and say, oh my God, is this true? Or if I do this, is this going to happen? And they become the source for accurate information. So we're also going to be doing, and they're going to be involved in something called a trick or vote. And we're going to have our interns on college campuses
instead of trick or treat.
You got it.
Okay.
You got it. So on Halloween, when everybody loves, does anybody not love Halloween? It's really in the communities around our health center and on the college campuses, in the schools, to ensure that people are registered and to get out and vote.
Right.
Actually, I have a question for you. Go back
Sure.
to services. You
Sure.
were talking about screening for men's cancer, testicular cancer before. What do you screen for women? Do you screen for certain cancers?
Yes, we do, certainly. Thank you for asking. Yes, we do breast cancer screenings, and we do cervical cancer screenings. And fortunately, we identify quite a few cancers, and women are living as a result.
Now,
of
early
that.
detection is paramount now.
It is.
Yeah.
It is paramount, and for those where there's a lot of bias against healthcare in general among certain cultures, and we do everything we can. We go out in the community about. We actually have a program with Adelphi, Adelphi's breast screening, breast cancer program, which is phenomenal, by the way. And we, in partnership, we're funded by the Komen Foundation, and together we go out into the community providing information, mainly to women of color, about the importance of breast cancer screenings and how to get them and how to have and to actually help them. We hold their hands to get them to a mammography. If they have insurance, phenomenal. Of course, that's accepted.
Right.
But we also work with the cancer screening programs that are funded by the state.
I'm assuming that screening isn't standard, though. So if someone comes in to use your services, they're not going to be screened.
We don't provide screenings. We don't provide the mammos. We do provide the screen. Oh, yes, we do.
Oh, just like someone comes in
For your regular
exam.
Yeah, your regular well woman exam.
Right.
Includes a breast screening.
Right.
Absolutely, because while you may not need a mammography until, and then there are certain guidelines for that. But yes, they do a screening, absolutely.
I just want to throw
for
something
everybody.
in here which is totally separate from our conversation. In the town of North Hempstead, Project
Yes.
Independence has a mammogram bus,
I know.
a mammogram van
And it's
that goes around to
fabulous.
different spots, and anybody who has an interest, if you're in the town of North Hempstead, you call 311 and they will direct you to when the next location is going to be. And Peter and I talk about this all
That's
the time.
really important.
Today, with computers, with technology, people are learning stuff sooner. I mean,
Yes.
people got in trouble years ago because they didn't know sometimes what they were doing.
Yes.
Now,
Yes.
education is paramount.
It is.
And I can call you up and I could be 15 years old. You answer my questions, whereas
Absolutely.
a 15-year-old 30 years ago had no place to go.
That's right.
And then next thing you know, she was in trouble, maybe got disowned even, which is terrible.
Oh,
but for something she really didn't know the consequence of the action.
Right.
You know, and
Right.
that's why something like Planned Parenthood is such a gift to the community.
We are. But it works both ways. I have to say, what we learn from our patients is phenomenal. And what they need, and so we learn from them. And then again, we do provide this great education in the community, because what you said is true. Knowledge is power.
Right.
And I'm this October, of course, is breast cancer
Right.
screening month. So we are doing an effort to promote that in our outreach program, of course, and then always. But every month people can can go to certainly a cancer CSP,
Right,
a cancer
right.
services center. for a mammo, and then again, that's state funded. And you asked about funding for Planned Parenthood.
Yeah, I was going to ask about that.
Yeah.
Because we
first.
we're about to go on it, and we just drifted.
Yes, I'm going to answer both of you.
Yeah.
So we are fortunate. We live in New York. And we are so fortunate that we are in New York because we are a state that believes in providing low-cost or free health care to everybody, quite frankly,
Right.
whatever the need is. So at Planned Parenthood, we have state and federal funding.
Okay.
The federal funding is for a program called Title X, and that goes up to the state, and then we apply for funding, and the state matches that money that they give to us by 3 to 1. So we have the Title X.
3. The state gives you 3 for every 1 that you get.
Yes.
Wow.
Yes.
Okay.
And what is
yes.
Title X?
And Title X is the nation's family planning program. It was put into place back in 1970 by Richard Nixon, and I wish I could say it was because of the out of the goodness of their hearts.
The altruism of Richard Nixon.
Exactly. Well, but he did have some good points, and he signed this program into law, and it was to provide free or low-cost family planning to at-risk women.
Wow.
And it's only for well woman exams, for birth control, for testing and treatment for STIs. It has nothing to do with abortion. There is no federal funding for abortion.
Okay.
Has always been that way. We hope that will change, but there has never been funding for abortion ever since Roe was passed in 1973. So, but the nation's family planning program it's a safety net. It's a safety net for women and men. So now, morphine, all those years later, funding is given to, there are applicants for it. In New York, it happens to be the State Department of Health. And so we get funding from both the state and the federal government. We also receive funding from the state and partially for the federal government for our sex ed programs in the schools.
Wow, okay.
And they are not only comprehensive, but they've been screened and tested, so we know that they're proven. They're proven to be successful. And the majority of the information that we provide is about preventing HIV, but it's also certainly about unintended pregnancies. So those are tested programs, not by us, but by experts.
Right.
Although we are an expert, but and we provide those in the schools. And then the other funding we get is certainly for fee-for-service. So if you go in, when you go to your doctor, you have insurance and you have a copay, and so we have. And then we bill insurance companies. We're just like your local gynecologist. The benefit that we have, though, is that we are a not-for-profit, and in our case, it's not just an IRS designation. We truly are a not-for-profit, and so we have amazing donors who give money to ensure that those who are not able to afford the phenomenal services we provide are able to access them. And
that's wonderful.
It is wonderful. And we raise a lot of money from private foundations and foundations, and of course from the amazing donors here in Nassau County and elsewhere too. People come from, we have donors all over, actually.
Wow. And even though we're not announcing them, I'm personally acknowledging them, because really without those people who are writing checks consistently, and volunteers.
That's right.
Between volunteers
that's right.
and major private donors,
right.
Organizations like this would just fold?
They would. They would, because, and we don't like it, but access to health care is, unfortunately for many, is not available. And we see access to health care as a right and not a privilege.
Right.
And that's why we do everything to possible to keep our doors open. When we were threatened by the current administration of defunding for all of our services. I mean, I'm talking about birth control. I'm talking about screenings and testings for men and women. All of those services were at risk, and we said, no, our doors are staying open, and our donors just stepped up.
Wow.
And that's what happens. That's what happens when when people care for other people,
right.
and that's really what our donors do. They care for other people because we can't depend on the government, even though New York State is phenomenal. There are so many other states that that do not provide.
I agree.
Do not provide.
I am going to
funding.
interrupt you
Sure.
because your donors care, but with this conversation,
Yes.
it's quite evident that you care.
Oh, God,
so when
yes.
the captain of the ship cares, then the team can care along with you.
I'm very proud of what we do, but as I said earlier, I see every day the benefit that we have to the people in our community. People come in and we get letters. Thank you for your just seeing me. Thank you for talking with me. Thank you for holding my hand. Thank you for being there. And moms come in with their we have a prenatal program, so they come in with their big baby, their big bellies, and they're so happy to be having that baby. And then because what's interesting, and people don't really appreciate it because I've seen this now for 20 years. Women who want to have a baby will do everything possible. They will spend thousands of dollars on IVF. Yes. They will lie in bed for 9 months. And for women who, for whatever reason, have made the decision that they cannot bring a pregnancy, bring a pregnancy to term, they will do everything possible to do just that, to prevent that pregnancy from coming to term. And so we do provide abortion services because they need to be safe, and in order to be safe, they have to be legal. And so, of course, we advocate on behalf of
You have to respect their wishes.
Safe and yes, we do. We have to. Everybody has to learn to trust women, by the way. Some laws that are on the books are very insulting to women, to say we can't make up our own minds. We don't know really what we're talking about. That's not true. Women know what they want,
100%.
and we have to have dominion over our bodies. So we do advocate on behalf of access to health care in general, because we believe so totally with every fiber of our being that health care is a right and not that privilege.
Wow,
That was wonderful, and I wish we had a little bit more time to get into private funding, and I wish I could say we have operators standing by right now, but we don't have that. But we're going to wrap this up, and on behalf of myself and John Ryan, I'd like to thank you for watching another episode of Project Safe, which is Seniors Against Financial Exploitation. And of course, a wonderful thank you to JoAnn Smith, who is the President and CEO of Planned Parenthood of Nassau County.
Thank you.
Project Safe is designed to help seniors, retirees, and adult children avoid financial scams and financial exploitation. Seniors Against Financial Exploitation. If anybody would like us to go out and present at their church, synagogue, or any civic organization, just give us a call at 516-719-6396. Once again, I'm Peter Janowsky, and this is John Ryan.
Thank you. Thank you very much.